Good morning. It's 102.7, 103.5 WICY, your feel-good favorites from the 80s and more. It's right around 9:40 and inside the community. We're going to go here. Joined from Hyde Medical Center, their Chief Operating Officer is Matt Jones. Matt, how are you today?
I'm doing well, and yourself?
I'm doing great. We've had Dr. Todd Whitman with us a lot lately, but here you come swooping in with plenty of great information for us, on how busy you've been and what's been going on over there.
Yeah, the organization at Hyde is our staff have done a great job of really, taking on this pandemic and doing as much as we can to try to make the patients feel safe and our community feel as safe as possible.
Sure. Give us a little more on the updates of reopening and stuff like that.
Yes, so reopening has been going well. We've changed a lot of things to try to make patients and family feel safe when they're coming into the hospital or any of our practices. We put a lot of things to do to make sure that they are not crossing each other as they're coming into waiting rooms or anything like that. We've basically eliminated waiting rooms as much as possible. And we have a lot more communication with the patients before they come in, just to check and see how they're feeling and how they're doing.
Yeah, when it comes to a lot of businesses, before this all happened and after, there's going to be such a difference. So with reopening comes reinventing. How are you going to do that with yourselves?
Yeah, reinventing has been a word that we've used a lot over the last 8 weeks. And there's a lot of different things that we've been trying to do. And one of the biggest things that we actually have pulled off in the last couple weeks is what we're calling curbside visits. And that's an opportunity for patients that don't necessarily have technology at home, a smartphone or an iPad or even Wi-Fi at home, that they can come to any one of our provider practices and actually sit in their parking lot. They're given an iPad and they can use the Wi-Fi that's in our parking lots, and they can see their primary care provider or even their specialty provider in the safety of their own car, but using internet so the providers can see the video of the patient.
Access and convenience combined there, huh? That's what we like.
Exactly.
So, reinventing, growing and developing. I know a lot of people think maybe COVID has put things to a standstill, but not with healthcare needs, right, Matt?
No, healthcare needs, especially over the last couple of years, have always been looking to change and be more efficient with things. I definitely feel like COVID has obviously hit the community hard, just as far as how is healthcare delivered. And, we've definitely looked at trying to do as much as we can to improve the patient care quality that we can give. And a lot of those things is, the way that we're doing things with communicating with the patients, with changing the way that we're handling things, some of the screenings that we're doing. We're really just trying to make the patients feel safe and comfortable, but it's also for our staff members as well. We want to make sure that they're feeling safe and comfortable, and our staff have done a great job with a lot of the new processes that we put into place. We opened up elective surgical procedures, probably about 2 weeks ago, and those have gone really well. I've heard a lot of great stories from not only patients but the families with the communication that we're trying to provide as patients are coming through.
Yeah, on what can seem initially like such a negative thing, we're putting a lot of positives around this, and I think that's the best way to kind of go through with this, no?
Absolutely. It's been. I think our staff have done a great job with really the changes that have been happening over the 8 weeks. There's been a lot of different changes, and some of them have been needed to be put into place pretty quickly. But the community has also done a great job. For us as a hospital organization, there's been a lot of changes, but even for the community and the way that they receive their care, it's changed a lot. But we want to make sure that the community understands and knows that we're here, we're safe, we're open, and we definitely don't want them to delay any care that they might need because it could actually progress and get worse than if we caught something early or help them manage some of their care needs earlier.
For sure. I got a question here for you, Matt, last one, and it comes down to as the phases open up and there's more businesses opening, how does that affect you guys? Are you guys kind of just having your own plan as far as progressing?
Yeah, we're definitely progressing internally. There were things that definitely slowed down for us as an organization, but we're also trying to be a community partner as well. So if there's businesses and stuff like that are opening that have questions around how to do something safely, or how they can try to treat their staff and their workers, we definitely want to be a community partner as much as possible.
Fantastic. Matt Jones, Hyde's Chief Operating Officer, with us here today, and I gotta say, it was kind of last minute I found out you were going to be with us, but man, it's been a pleasure, Matt.
I appreciate it. Thank you very much, John.
All right, take care. It's 102.7, 103.5 WICY, your feel-good favorites from the 80s and more inside the community.